We need some fundamental public health measures that everyone should be adhering to, not a disjointed one state says one thing, the other state says another thing. So we need to respond as a nation, not in a fragmented way.
But right now it is fragmented as states and cities continue to roll out their own coronavirus restrictions. Ohio, Maryland, Montana, and Illinois issued regulations on business hours and crowd sizes statewide. California Governor Gavin Newsom issued a more stringent mask mandate, requiring all residents in the state to wear a mask outdoors with limited exceptions. Iowa Governor Kim Reynolds imposed a limited mask mandate after pushing back at the policy for months while still insisting that there is science on both sides. In South Dakota, Rapid City schools are planning to close and move to virtual learning today. Nevada's Clark County, which includes Las Vegas, postponed plans for in-person instruction, opting to continue with remote learning through the end of the year. And in New Orleans, officials canceled the famous Mardi Gras parade as the cap on outdoor crowds is limited to 250 people. Meanwhile, hospitals across the country are at or over capacity. Joining us now, the CEO of West River Health Services in Hettinger, North Carolina, Matthew Shahan. Matthew, I guess, first of all, give us the status update on your hospital.
Yeah, good morning. Thank you for having me on. Our hospital, I think, is faced much like the rest of the rural hospitals in this country. We have what we would normally be dealing with during these times, but then you add on top of it the coronavirus pandemic. And what it's creating is an unsustainable model for rural health care. You know, from a staffing standpoint, we only have so many people we can draw in, and those people are tired. Many times they work other jobs. They have farms and ranches at homes that they have to take care of. And quite honestly, they're burned out already. And that's the concerning thing for us is, you know, we don't have a large labor pool, and where we're sitting at, we have what we have, and they're the best group of doctors, nurses, lab, radiology, and housekeeping we could find, but there's only so many of them, and that's my number one concern right now.
Okay, literally running out of doctors and nurses. That's a pretty big concern. What about supplies and space?
Yeah, supplies. I think our state did a great job leading up into this pandemic and has done a good job of delivering those supplies during this time. So, you know, we're doing pretty good on supplies, I would say. Space is certainly the issue. We only have so many rooms that are negative pressure where we can handle these types of patients. And if we take them outside of that controlled space, then we put the rest of our staff at risk. We deliver babies here. And so we have to really be protective of where we keep these patients because we don't have a large building. We don't have separate floors that we can house these patients. So we really have to be restrictive and careful. And unfortunately, that means it limits the number of coronavirus patients we can care for.
Hey, Matthew, it's Willie Geist. It's great to have you on this morning. There's a staggering banner on the bottom of our screen right now that I had to look up twice before we came on together. It says North Dakota records world's highest COVID mortality rate, the world's highest COVID mortality rate, 18.2 deaths per 1 million people. So as you are here right now with a national audience, what do you all need in North Dakota and who do you need it from?
I think we need to look at each other and realize that what rural has always succeeded in is taking care of each other. You know, when a farmer goes down, their neighboring farms step up and help them get their crop out of the ground. And what we need right now is just common sense. We need folks to wash their hands. We need them to socially distance. We need them to wear a mask when and where possible. I know it's uncomfortable. I don't like wearing one all the time, but how can I look my staff in the eyes if I'm not willing to do such a simple thing to protect them and protect their patients when, quite honestly, daily, weekly, you know, they are caring for their neighbors, people they've grown up with their entire lives who are in our COVID unit on their deathbed. I don't think I'd be a very good leader if I did that.
And the governor did issue a statewide mask mandate a few days ago, made some news last week, and maybe you can help us understand this a little bit better when the governor said that COVID positive healthcare workers, as long as they're not showing symptoms, can return and work in COVID units. That took a lot of people by surprise. Is that okay with you to have COVID positive healthcare workers inside your hospitals?
You know, as an organization, or as the healthcare world, we certainly appreciate that measure being taken. But as this organization, we have chosen to not utilize those staff. If they are COVID positive, we want them home and getting better. This is a long-term disease. This is something that's going to be around for a while. We cannot risk having them come into the unit, whether they have it or not. We want them to stay away from the building so we can really limit those touch points where they could pass that on to another coworker. So while we really do appreciate it, at this point, we haven't been forced into that situation. And I hope that is our absolute last measure, because I don't want to have to make that decision.
Yeah.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.